Hello, nursing students. This is Heather Vernillo, and we are going to be doing weeks 1 and 2 talking about the fundamentals of nursing pharmacology. So in these 2 weeks, you're going to learn about your pharmacology basics, your key concepts of pharmacokinetics and pharmacodynamics and pharmacotherapeutics. You're going to start learning about drug interactions and adverse reactions, and we're going to review the nursing process. During your first 2 weeks and over the 12 weeks of this course, we will always be talking about the pharmacology basics. Every medication class, every subject that we talk about over the next couple of weeks, we'll come back always to those pharmacology basics. So always know that pharmacology is the scientific study of the origin, nature, chemistry, effects, and the use of drugs. And this knowledge is essential for you as the nurse to provide safe and accurate medication administration to your patients. All right, so the big three that you learned about in your book is pharmacokinetics, which is talking about the absorption, distribution, metabolism, and excretion of drugs by the body. And then we have pharmacodynamics, is the biochemical and the physical effects of the drugs and the mechanisms of that drug action. And then pharmacotherapeutics is the use of drugs to prevent and treat diseases. And in addition, we're going to discuss other important aspects of pharmacology, like how are drugs named and classified, how are drugs derived, how are drugs administered, and how do new drugs get developed? So naming and classifying drugs. Drugs have a very specific type of nomenclature, and this is what I stress to all of my students who are struggling with pharmacology is start looking at the generic name and start learning how to look at the root of the name to know which classification that drug belongs to. If it has an OLOL, we know it's going to be a beta blocker. If it ends in statin, we know it's most likely going to be a cholesterol drug. If it ends in PRAM or PAM, we know we're going to be in the mental health drug arena. Now, there's always exceptions where drugs could be used in other entities with other uses, other FDA indications, but in general, your ARBs, your ACEs, your calcium channel blockers, things like that will fall with the same sort of root word. A lot of your biologic drugs will all end with the same root word. So we have the chemical name, which is the scientific name that precisely describes the drug's atomic and molecular structure. And then there's the generic name, which is the non-brand name. And then we have a trade name. The trade name is the brand name. It's the proprietary name. Zofran, for example, is ondansetron. Tylenol is a name brand. Acetaminophen is the generic. So to avoid confusion, in nursing school, we tend to use the drug's generic name because one drug can have many trade names. So the federal government mandated the use of official names so that only one official name could ever represent a drug. And those are all listed in the United States Pharmacopedia and National Formulary. Drugs that share similar characteristics are grouped together into what's called a pharmacological class, like beta-adrenergic blockers. Or we have our NSAIDs. A second type of grouping is the therapeutic class, which categorizes drugs by their use, their therapeutic use. So like antihypertensives is a therapeutic class, but under that therapeutic class are pharmacological classes. That's your beta blockers, your calcium channel blockers, your diuretics, things like that. So where do we get drugs from? They can come from natural sources like plants, animals, and minerals. Yes, animals. And today we have the knowledge to make synthetic drugs. Chemical science has done wonders, since the start of penicillin. So when we look at animal sources, insulin originally, a hormone originally came from an animal. Some vaccines came from animals. Desiccated thyroid comes from a pig gland. Metallic and non-metallic minerals can provide various materials to use for different drugs like iron, iodine, Epsom salts. And then remember, you have to go back to your fundamentals of nursing, where we learned about the different routes that drugs can go. Now, there is by mouth, like PO, which is basically just putting the pill in and swallowing it. But we have buccal, we have sublingual, and we have translingual. And certain drugs, like nitro, is going to be given buccally, but in that pouch between the cheek and the teeth. Things like Suboxone films and Suboxone pills are going to be taken buccally. We have sublinguals, which go under the tongue, and we have translingual, which sits on the tongue. Intradermal are drugs that are injected into the skin, and a needle is usually inserted into like about a 10 to maybe 15 degree angle so that punctures only the skin surface. So we usually use this for allergy testing, for TB testing. It's not really used for medication administration. Intramuscular is just like it sounds. It goes in the muscle. And we use various muscle groups depending on the quantity of the amount of fluid we are given and the viscosity of the fluid. IMs have a pretty rapid systemic action for absorption, and we can give relatively large doses if we're using a big muscle group. Aqueous suspensions, anything in oil, has to go IM. You're not going to put oil into the sub-Q area. And we have intravenous, which means in the vein. So that allows injection of drugs or other substances to go directly into the bloodstream via the vein. So there are medications that you would never push through an IV, something like potassium chloride. Potassium chloride can be hung in an IV bag over a slow drip, but we would never IV push a medication like potassium chloride. You may see medications, especially if you are working in some of our nursing homes or assisted living facilities, you might have drugs that are written PV or PR for per rectum or per vagina. And we have suppositories, ointments, creams, gels. Any of those materials can be instilled into the rectum or the vagina, and the mucosal area of those locations absorbs the drug systemically. Respiratory, inhaled, your inhalers, your meter dose inhalers, that the respiratory route can also be used in emergencies. Sometimes if you're in NICU, or maybe if you're doing emergency medicine and you don't have an intravenous route yet, there are medications that can actually go through the endotracheal tube. And then subcutaneous is basically where you can pinch an inch of fat, is where you can give a sub-Q injection. Upper arm, the back of the upper arm, your thigh, your abdomen, always stay away from the belly button. We want to stay 2 to 3 finger widths away from the belly button. Very nice muscle around that umbilical area that it does not work very well for absorption of meds. And it hurts. And it can bruise, so we stay away from there. And then topical. Like it sounds like, it's drug delivery via the skin or a mucosal membrane. And then there's the less common ones, like epidural, meaning it's medication going in the epidural space. Intrapleural is injected into the pleural cavity. Intraperitoneal is going into the peritoneal cavity. Intraosseous is going into the bony matrix of a long bone. And then intra-articular is going into a joint. If you've ever had a joint injection, it's an intra-articular injection. When we're talking about pharmacokinetics, we're referring to movement. The word kinetics is movement. Go back to your classes in chemistry and biology where you learned about kinetics. Pharmacokinetics deals with the drug's actions as it actually moves through the body. So remember that kinetics is movement. Therefore, pharmacokinetics is going to look at how is a drug absorbed, how is it distributed, how is it metabolized, and then how is it excreted from the body. And this branch of pharmacology is concerned with the drug's onset of action, its peak concentration level, and what's the duration that this medication is going to be active. And then what are factors that can affect the absorption of the medication? What things like route of administration, the amount of blood flow, the formulation of the drug, all of this can affect the rate that the drug is absorbed. It only a few cells separate the active drug from systemic circulation, then absorption is going to occur rapidly, and the drug is going to quickly reach a therapeutic level in the body. So drug absorption occurs within seconds or minutes when administered sublingually, IV, or by inhalation. Absorption occurs at slower rates when it goes oral, IM, or sub-Q because of that membrane system of the GI mucosal layer. The muscle and the skin is going to delay passage of that medication. At the slowest absorption rates, drugs can take several hours or days to reach peak concentration levels. And a slow rate usually occurs with rectally administered or sustained release drugs. Several other factors play a role here in the absorption of the drug. Most absorption of oral drugs occur in the small intestine. So if a patient has had a large section of the small intestine surgically removed, then drug absorption is going to decrease because the reduced surface area and there's a reduced time that the drug will be actually sitting in that small intestine. And when you're reading in your book, you may have heard the term of first pass metabolism. That has to do with how the drug is absorbed by the small intestine and then transported to the liver before being circulated to the rest of the body. So the liver may metabolize much of the drug before it actually enters the circulation of the body. So this mechanism is referred to as the first pass effect. Liver metabolism may inactivate a drug, and if so, first pass metabolism lowers the amount of the active drug released into systemic circulation. Therefore, higher drug dosages need to be given to the patient to achieve the desired effect. And you may have read things about breaching barriers, and the ability of a drug to actually cross a cell membrane will depend on whether the drug is a water or lipid, otherwise known as fat-soluble medication. Lipid-soluble drugs can easily pass through cell membranes, where water-soluble ones actually can't. Lipid-soluble drugs can also cross the blood-brain barrier and enter the brain. Now, most drugs that we give a patient are going to be metabolized by the enzymes in the liver. But metabolism can also occur in the plasma, in the kidneys, or in the membranes of the intestines. Some drugs inhibit or compete for enzymes, which can cause an accumulation of drugs when they are given together. And this accumulation increases the potential for an adverse reaction or a drug toxicity. And certain diseases can reduce the metabolism of a medication. Liver disease like cirrhosis or heart failure will reduce circulation to the liver and will reduce metabolism of a medication. And you'll see a lot about a half-life of a drug. And a half-life of a drug is the time it takes for the plasma concentration of that drug to fall to half of its original value. So if I gave you 50 milligrams, how long before it's 25 milligrams in the bloodstream? So the time it takes for one half of the drug to be eliminated by the body. And factors that affect a drug's half-life include things the rate of absorption, the metabolism, the excretion, And knowing how long a drug remains in the body helps determine how frequently a drug should be taken. So things like Xanax, the half-life is actually rather short, which is why it has such a high abuse potential, because half of it is gone within a few hours, which makes a person want to take the medication again to achieve the same effect that they got the first time that they took it. Whereas other drugs may have 72 hours before it hits half-life. So those drugs don't need to be given as often as something that you might see written as every 4 hours. Those ones might be written once a day or every 2 days or maybe 3 times a week. Other factors that affect a patient's response to a medication is physiological and psychological different factors, age, cardiovascular function, their diet, their disease, what other drugs are they taking, their gender, their GI function, their hepatic function, whether or not they have an infection, and how well are their kidneys functioning. Certain drugs have a tendency to create a drug tolerance and a drug dependence in the patient. Drug tolerance occurs when the patient has a decreased response to the medication over time, and the patient then requires larger doses to produce the same response. And then we could have an increased desire. So tolerance differs from drug dependence, in which a patient displays a physical or psychological need for the drug. Physical dependence will produce withdrawal symptoms when the drug is stopped, whereas psychological dependence is based on the desire to continue taking the drug to relieve tension or avoid discomfort. Food can alter the therapeutic effect of a drug, as well as the rate and the amount of drug absorbed from the GI tract. So that can affect your bioavailability. The amount of the drug dose available for systemic circulation is your bioavailability. Dangerous interactions can occur because of this. For example, when food contains something like tyramine, which is in like your aged cheeses, and somebody is taking an MAOI, you could actually put them into a hypertensive crisis. Grapefruit juice can actually inhibit the metabolism of a lot of medications, and it results in toxic blood levels. And during the time you are with me in this program, if you have me as an instructor, you are going to hear me talk a lot about the nursing process. And it's one of the most significant advances in nursing was the development of this nursing process, because this is your problem-solving approach to nursing care. You are getting a method of determining the patient's health problem, developing a care plan to address that problem. Then you're going to implement your plan. You're going to evaluate whether your plan worked. The nursing process guides your nursing decisions about drug administration to ensure patient safety and to meet medical and legal and ethical standards. And the 5 steps of the nursing process are assessment, nursing diagnosis, planning, implementation, and evaluation. So we call it ADPI. So assessment, you are going to be collecting data. In nursing diagnosis, we're using something called the NANDA, and the NANDA helps us by giving a nursing diagnosis that's a clinical judgment about the individual and their actual or their potential health problem or life process. Nursing diagnosis provide the basis for the selection of your interventions to achieve an outcome for which the nurse is accountable. So risk for infection for somebody who might have a cut versus somebody who actually has a fever. They're not risk for infection anymore. They have the infection. And that's going to change how your interventions are. Where we clean the wound, we try to prevent the infection, but now it didn't resolve. Now we have the infection. What are we going to do? We're going to put topical antibiotics, maybe systemic antibiotics. We're going to do wound care. We're going to do patient education. And then we're going to go back and evaluate how well did we do? Did the patient return demonstrate? Did the patient, get their medications and remain fever-free? Did the patient get discharged to the hospital, discharged home, within 3 to 5 days? Whatever our implementation and our plan was, we need to go back and evaluate whether or not it worked and what do we need to do to change to achieve a measurable goal. So let's do a quick quiz. How is a drug absorbed or excreted? What is that called? And the answer is pharmacokinetics. That involves absorption, distribution, metabolism, and excretion of a drug. What type of drug interaction occurs when two drugs that produce the same effect are given together? And this is a fancy word called potentiation. And that occurs when two drugs produce the same effect are given together. One drug enhances the effect of the other drug, resulting in greater effects of both drugs, which is different than your synergistics, which we learned about last week. So expected outcomes are defined as realistic, measurable goals for the patient. Remember that, realistic and measurable goals. So thanks for listening in to your fundamentals, week 1 and 2 for your pharmacology course here at Quest.